Regencell Bioscience is a company with a very specific and ambitious goal. Founded in Hong Kong in 2014, it aims to develop treatments for childhood neurological disorders, particularly attention deficit hyperactivity disorder, or ADHD, and autism spectrum disorder, also known as ASD. Instead of pursuing conventional Western pharmaceuticals, Regencell is focusing on something different: traditional Chinese medicine, or TCM. The company is working on creating its own special oral formulas using natural ingredients that have been part of TCM for centuries. The idea is to offer a new, alternative path for families seeking help for these complex conditions, moving away from standard medications and toward a more holistic approach rooted in ancient practices. The core mission of Regencell is to provide hope where many feel options are limited. For parents and caregivers navigating the challenges of ADHD and autism, the prospect of a natural, non-pharmaceutical treatment is incredibly appealing. The company's entire identity is built on this promise. It represents a potential breakthrough in a field that can often feel slow to innovate. By blending ancient wisdom with modern bioscience research, Regencell hopes to scientifically validate and standardize TCM formulas. This would make them accessible and trustworthy for a global audience that is increasingly open to alternative and complementary medicine, a trend that has been growing in recent years across the world. However, it is crucial to understand where Regencell stands today, on July 1st, 2025. Despite its compelling story and noble mission, the company has not yet brought any products to market. It has not received regulatory approval from major health authorities like the FDA in the United States or similar bodies elsewhere. This means that while the ideas are powerful, the actual, sellable treatments do not exist yet. The company is still in the research and development phase, conducting studies to prove that its formulas are both safe and effective. As of now, its progress is based on early-stage studies, including a recent case study involving a small group of patients. This puts Regencell in a precarious but not uncommon position for a bioscience startup. It is a company built almost entirely on future potential rather than current success. Its value is not derived from sales or profits, because it has none. Instead, its worth in the eyes of the public and investors is tied to the belief that its research will one day lead to a revolutionary product. This makes the company a story of hope and promise, but one that is still waiting for its most important chapters to be written. The journey from a promising idea to a government-approved, revenue-generating medicine is long, expensive, and filled with uncertainty. In the first half of 2025, something extraordinary happened to Regencell's stock, known by its ticker symbol RGC. The company's share price didn't just climb, it launched into the stratosphere, posting gains that were almost unbelievable, with some reports citing increases of over 12,000%. This incredible surge turned a little-known bioscience firm into a hot topic among investors and financial news outlets. The stock reached a dizzying peak in mid-June, with its total market value swelling to a staggering $39 billion. For a brief moment, this company with no revenue was valued more highly than household names like Kraft Heinz and Lululemon, a truly mind-boggling comparison. A key event that ignited this firestorm of buying was a 38-for-1 stock split that took effect on June 12, 2025. A stock split doesn't change a company's fundamental value, but it makes each individual share cheaper and more accessible to smaller, everyday investors. After the split, what was once a higher-priced stock became available for a much lower price per share, attracting a flood of new buyers. This surge in demand, fueled by newfound accessibility, sent the price soaring. In the days following the split, the stock jumped by hundreds of percent, creating a frenzy of excitement and drawing even more attention from traders looking to ride the wave. The story of Regencell also resonated deeply with a growing public interest in alternative medicine. This narrative was amplified by public figures, including U.S. Health and Human Services Secretary Robert F. Kennedy Jr., who have voiced support for exploring different health solutions. Regencell's focus on using TCM to treat ADHD and autism provided a compelling and easy-to-understand story. It was a narrative of challenging the medical establishment with natural remedies, a theme that captures the imagination. This powerful story, combined with the stock's explosive gains, created a perfect storm of hype, particularly on social media platforms and online forums where retail traders gather. This intense excitement from individual investors, often called retail traders, was a massive driver of the stock's price. Regencell became what many now refer to as a meme stock. This is a stock whose price is driven more by social media hype, viral trends, and collective buying from online communities rather than by the company's actual financial performance or business fundamentals. People weren't just buying a piece of a bioscience company, they were joining a movement, participating in an exciting high-stakes story that was unfolding in real time. The fear of missing out, or FOMO, became a powerful force, pushing the valuation to levels completely disconnected from reality. While the excitement around Regencell's stock has been immense, a closer look at the company's financials reveals a much more sobering picture. As of today, Regencell has generated zero revenue. It has never sold a product because it has no approved products to sell. In fact, the company is losing a significant amount of money as it spends on research and development. Over the last 2 fiscal years, it has reported combined net losses of over $10 million. This is a classic high-risk scenario, a company with enormous expenses and no income, whose entire value is based on the hope of future success that is far from guaranteed. The biggest reason for the stock's extreme price volatility is a concept known as low public float. The company's CEO, Yat-Gai Ao, controls over 86% of Regencell's 500 million shares. This leaves a very small number of shares, only about 30 million, available for the public to trade. When the supply of something is very limited, even a small increase in demand can cause its price to skyrocket. This is exactly what happened with RGC. The buying frenzy from retail traders was concentrated on a tiny slice of the company's total shares, leading to the massive, exaggerated price swings that we witnessed in June. Furthermore, the scientific evidence supporting Regencell's treatments is still in its very early stages. The company's clinical data is limited, with its most relevant research being a late 2023 case study on just 28 patients with ADHD and autism. While promising, a small-scale study is a long way from the large, rigorous, and controlled clinical trials required by regulatory bodies like the FDA for a product to be approved. Without this robust clinical data and subsequent regulatory approval, the company's TCM formulas remain an unproven concept in the eyes of the medical and scientific community, making any investment in the company highly speculative. All of these factors, no revenue, significant losses, a low public float, and a lack of conclusive clinical data, point to one conclusion. The stock's valuation became detached from its fundamental reality. The price was not driven by business performance, but by market speculation, hype, and the unique mechanics of its stock structure. This makes it an incredibly risky investment. Financial regulators like FINRA have even issued general warnings about the risks of market manipulation in small-cap companies from the region, adding another layer of caution for potential investors who might be tempted by the headlines of massive gains. After its meteoric rise, Regencell's stock has started to fall from its peak, leaving many investors wondering if now is the right time to buy in at a lower price. The simple answer, based on all available evidence, is that RGC remains an extremely high-risk, speculative bet. Buying the stock today is not an investment in a proven business. It is a wager on a series of future events that may or may not happen. The current price, even after its recent decline, is still considered by most analysts to be wildly overvalued when measured against traditional metrics. The company has no sales, no profits, and no approved products, the essential pillars of a stable investment. So what should an investor look for before even considering putting money into Regencell? The most important milestone would be regulatory approval. The company needs to successfully navigate the long and difficult process of getting its TCM treatments approved by major health authorities, such as the FDA. This would be the ultimate validation that its products are both safe and effective, transforming them from a hopeful idea into a tangible, marketable asset. Without this approval, the company's core business proposition remains purely theoretical, and the risk of failure is immense. This is the single most important hurdle the company must clear. Another critical development would be the generation of significant and sustainable revenue. Once a product is approved, the company must prove that it can successfully market and sell it. Seeing a steady stream of income on its financial reports would demonstrate that there is real market demand for its treatments and that it has a viable business model. This would shift the company's valuation from being based on hype to being based on actual performance. Consistent revenue growth would signal that Regencell is transitioning from a speculative startup into a legitimate bioscience enterprise, which would fundamentally de-risk the investment. In conclusion, for the vast majority of investors, now is a time for extreme caution, not for bold action. The story of Regencell is a powerful case study in the difference between market hype and fundamental value. While the promise of an alternative treatment for ADHD and autism is compelling, the company has not yet delivered the results needed to justify its massive valuation. Before considering an investment, a prudent person should wait for concrete proof of success, regulatory approval, robust clinical trial data, and most importantly, actual revenue. Until then, Regencell Bioscience remains a fascinating story of hope, but a perilous place